We're minutes away from the hospital, but this isn't the time to relax. Everything we've done so far, the medications, the 12-lead ECG, the transport decision, was leading up to this moment. Now, we have to get this patient into the right hands, with the right information, and without delay. Because in a STEMI, time isn't just muscle, it's survival. The moment we recognized that ST elevation, we weren't just thinking about transport. We were thinking about getting this patient to the cath lab as soon as possible. Welcome to episode 4 of Heart on the Line, a paramedic's guide to cardiac care. Giving a report to the ER isn't just about listing details. It's about telling a story. If you give too much information, you're wasting time. If you give too little, they might miss critical clues that they need. A perfect handoff is short, structured, and to the point. Think of it this way, is that if you were to write a children's novel or a children's book, you would want to make sure that it's structured and to the point. It's the same kind of thing when it comes to a report, so that way all the information is easily gathered by the team that's listening and they're able to make decisions based off the information that you give them. So start off with the easy stuff, like age, gender, and chief complaint. Then move on to how you found the patient. So time of onset and the progression of symptoms of what you found. Vital signs and trends will help kind of make a clear picture of what the position this patient is in. And then finally, your ECG findings. After you've done all of these assessment findings and the vital signs findings, then you could talk about what treatments that you have started. So medications or any other treatments. When you're talking to the team about medications, it's not about just what you gave them, it's also about how they responded to that treatment. So if you've given nitro, make sure that you mention that you gave nitro, but also mention what time you gave it and what the patient's response was. Did they have a decrease in blood pressure? Did they have a decrease in their pain? Those are the kind of things that a team needs to know in order to start to create their path of how they want to treat this patient. This is what a good and structured report would sound like for this particular patient. We have a 56-year-old male, sudden onset of crushing chest pain for about 45 minutes. ST elevation was found in leads 2, 3, and AVF. Vital signs, blood pressure is stable at 132 on 80. Heart rate is 88. SpO2 is 96%. We've given aspirin and 2 doses of nitro. Pain initially was 8 out of 10, and after those 2 sprays of nitro, it is now 5 out of 10. We've also given fentanyl, 25 micrograms, and pain has now reduced to 3 out of 10 with that. That was under 30 seconds, but it contained everything that they need to know in order to get started. Then we can start to build upon that by giving medical history, any type of medications they may be on, and so on and so forth. But that information that we gave them everything they need to know to get started, and that's the key. And then we start working on all the extra information that can help build the picture that they require. Remember, STEMI activation is more than just a phone call. It's a difference between an open artery and a dead heart. When we recognize a STEMI, we don't wait until we arrive. We activate the cath lab while we're still on the road. That way we save 15, 20 minutes for this patient, and that's really can make a big difference in how much tissue is lost. PCI is the gold standard for treating a STEMI. Think of it like a traffic jam on a major highway because of a jackknife trailer. Basically what PCI is going to be is that we have a huge backup of flow right now because of that trailer. But what PCI is going to do is take a crane, pick up that trailer right off the road so that way we can restore flow immediately. That is how PCI works in order to restore flow almost immediately. That's why choosing the right hospital matters. If a PCI center is within 90 minutes, that's where we go. If not, we may have to consider thrombolytics. But either way, every second counts. Even experienced paramedics can make a mistake. And one of the biggest mistakes that we can make is misinterpreting an ECG. STEMIs aren't always textbook. Sometimes the changes are subtle, and sometimes the symptoms don't match the ECG. That's why we treat the patient, not just the monitor. So when in doubt, send the ECG in order to get interpreted at the hospital and see if they want to activate a STEMI protocol. With that being said, not all myocardial infarctions present as chest pain. Women, diabetics, and elderly patients might only report nausea, fatigue, or jaw pain. If something feels off, trust your instincts. Get the ECG, treat early, and transport fast. With this patient, we made all the right calls. We recognized the STEMI early, we gave the right medications, we activated the cath lab, and we got him to PCI without delay. That's what pre-hospital care is all about. Not just treating the symptoms, but making sure that the right systems are in place before we even arrive. Thank you for watching our Heart on the Line series.